All right, Caitlin, am I good to go?
Yes.
Okay, good. Sorry, I was waiting for like a green light or something to say, go ahead. Sorry about that. So welcome everyone to our January meeting of our Caregiver Aging in Place subgroup. We're excited to bring you all together in the new year, and Happy New Year, everyone. So I'm privileged again just to welcome you all. Excited to be together again. Just as a recap, we have not held an Aging in Place, the full working group meeting between our last meeting and now. So our last meeting of the subgroup was December 6th. The Aging in Place working group has not yet met, but our next meeting of the full working group is scheduled for January 21st. So our goal really, as we've stated in our previous meetings, is to really come up with 2 to 3 truly actionable items that the state can look at in terms of supporting and influencing and improving the caregiver workforce. And this certainly includes our family caregivers, who are sort of that invisible, unpaid workforce, but certainly a really integral component to the workforce issues affecting our state, which is also a really important component to allowing Delawareans to age in place. We need that workforce, and we need to support those family caregivers. So we have a pretty robust agenda today. I'm excited for the presentations and the speakers that we have planned. So you'll see the agenda that Caitlin has put here on the screen. As a start, we need a motion to approve last month's meeting minutes. So before we do that, were there any questions, concerns, comments about last month's meeting minutes? Again, that was from December 6th, and you all should have received those in an email. So I guess without any questions or concerns, do I have a motion to approve the December 6th subgroup meeting minutes?
So moved.
Thank you, Wendell. Do I have a second?
Second.
Thank you, Brian. I guess all in favor, raise your hands. Great, well, thank you all. So meeting minutes approved. So next we have a report from service providers. I know Brian shared that he had reached out to some of the personal care providers to get their feedback on work to improve the caregiver workforce. So Caitlin, I'm not sure, were we going to call on any specific service providers here who have joined us from the public, or were we going to share what some of the comments that Brian specifically received?
I think the idea was for the subgroup members who are providers to
gotcha.
share what they have. So certainly, Brian could go, and anybody else who is a provider.
Okay, great. Thanks, Caitlin. So I guess, Brian, sorry to put you on the spot, okay, but as you had shared with us, you had reached out to some of the providers to get their feedback and input. So do you want to share a little bit about what you received?
Sure. So honestly, I sent to 50 different personal care providers. Only 5 responded. 4 were simply generic. Thank you for doing this work. I do have input, and I'll get it to you in the future. None of them have followed up. The one person who went above and beyond was Mr. Kenbach of Cheer. He shared some ideas, which I think I gave to Caitlin, and she shared with the work group. I don't have the ability right now to share on the screen unless Caitlin has them available. I can read through them from another screen, or if Caitlin has them, she can share them again. Up to you.
Let's see. So I just changed the settings so that you should be able to share your screen.
All right, let's find it amongst the million things we got going on here.
And also I see that Ken Bach is actually with us in the meeting as an attendee.
Yeah. Okay, can you see my screen, Katie?
Yep, I can see it, Brian. Thank you.
Great, and I'm glad that Ken's here with us. And I think a lot of these are duplicative of some of the thoughts that we had, but they may be a little bit more in-depth and meaningful than how far we had gotten. So the way I proposed the question to all the service providers was in different pieces. So you'll see here the bullet, gain youthful long-term direct service providers interstate. That was one of the questions. And I could read these verbatim if you like. He said to establish a forum or a working group with VOTEC and community colleges to develop and promote curriculums that train students for service provider positions. There continues to be large demand for these positions at entry level right out of school. Many employers provide full-time opportunities with benefits. Said also develop outreach efforts to immigrants or often non-English speaking communities to inform and promote service provider as an attractive or viable career path. Perhaps alternative to poultry plant, landscaping, etc. May need to provide English language training, but seems this is a large untapped labor pool for service care workers. Key may be to establish credible inroads and relationships with community leaders. So I'll pause there and allow comment from the group.
I think those are both great ideas.
Anyone else before I move on? And we can obviously earmark these for further discussion later as we look to point towards certain things that we can do and certain things we can't, so we can narrow this down as to what we think is the most viable option for us.
This is
Yeah.
just a quick question on my part. This is Cheryl Heiss. I just had a question.
Cheryl.
Are there background checks required and all that in this environment or no? In personal care?
Yeah, I'll let the service providers answer that question that are on the group.
Just because sometimes some of these other areas have been more difficult with some of those folks, but I agree, these are great ideas.
I know Bob's on the call. He may know better than I as to what the background checks are.
Yeah, if it's, if they are going to be participating with a licensed provider by the state, they've got to, they would have to comply with the state background check requirements, fingerprinting, all of the various health requirements. So, and somebody's got to pay for that, by the way. They've got to get to Dover and register with the state police. It's not going to be easy for immigrants who may be hesitant to participate if they're going to have to present themselves in front of the state police and be fingerprinted. So I would just toss that out as a practical matter.
This is Verna at Easter Seals. I'll just chime in here too, that this is, there's Medicaid regulations that have to be complied with, which if you're accessing this through Medicaid dollars, that impacts the kind of qualifications and requirements like the background checks, the fingerprinting. But it is definitely worth looking at. We see more and more in the developmental disabilities field that we are utilizing the immigrant population and very well. So it's definitely something that should be that we should be pursuing. The challenge continues to be in terms of attracting like the students, developing a curriculum and establishing sort of that career path. And we talked about this before, but it continues to be the wages. They need to have something that they're striving for that's going to help them make, earn livable wages. But all really good suggestions.
Yeah, I think that we'll get to that suggestion. It'll be the overwhelming one, probably, I think, for all of us.
And if they do want to move up that career ladder and go to higher certification, then there's also testing requirements. And if we need to make sure that the tests that these folks would be participating in are in their language, so that they have the opportunity to do well in those required tests to get that higher career ladder that Verna mentioned.
So I would just add that as a practical matter, the ability to communicate is really important. So there may be some language challenges involved with this group. I know we found that, people can be motivated and highly responsive, but the population that they're going to be dealing with is sometimes not as tolerant of people that may have slight different backgrounds than they do. So I just, as a practical matter, that exists.
And this is Jackie, also to add to that, not only the language, but literally the trouble to be able to read everything, to understand a plan of care. There sometimes tends to be a little bit of confusion to really, kind of correlate their background with ours. So you have to kind of look at the whole scope of it.
Okay. So Caitlin, Ken Bach messaged me, and I assume that he's through the public forum and can't speak at this point. I don't know if you have the ability to allow him to interject as I continue to go along or not.
Yes, I
Okay.
just unmuted him.
So what I'd like to do is I'll continue because this is a little bit lengthy and I don't want to take up too much time. So I'll continue on.
And I don't want to interrupt this Ken Bach, but I am going to have to leave at 10:30. Just a quick point to the language issue, and it is a significant issue, but given the shortages that we currently are experiencing and will continue to experience, and the size of the potential labor pool, certainly in Sussex County at the entry level, I think it's something that we're going to have to devote some time and resources to, because I don't think we can ignore that potential labor pool.
I happen to agree with that, by the way.
Thank
Okay.
you.
Yeah,
Ken,
he's just, Bernice, I feel very strongly in agreement with Ken on that one.
Ken, thank you for responding to the questionnaire and giving us this feedback. It's really helpful.
And anything we can do to help with this issue, because we're all in this boat together.
Absolutely.
Okay, I'll try to get through the next one while we still have Ken on the line. So the next one was regarding retention. Working conditions and wages are an ongoing problem. Attracting, retaining service care workers, wages, employers serving private sector customers are able to raise prices to whatever the market will pay in order to generate income, to provide increased employee compensation and bonuses. State service contractors are more limited due to fixed unit price contracts. Absolutely true. In our experience, offering health insurance benefit has little to no value to most service care workers, since many already receive some form of subsidized health insurance. Employers must still offer that benefit, which is a cost for services that need to be funded. And he talks about working conditions. In-home care service providers are required to travel distances between customers' residences. This requires additional expense and time. Pardon me. This requires additional expense and time on the part of the service worker. Additionally, worker schedule hours are often erratic and subject to change in responding to changing customer conditions and service demands. And the last piece is possible solution. Some customers have very specific time needs, very time specific needs, but in case where there is not a time specific requirement, if service providers of these publicly funded services could have flexibility in directing when services would be provided, the providers could provide more attractive working conditions by grouping and aligning customer services by geographic area and service times to reduce travel and provide straight work shifts without splits in work hours during the day. Now open it up for comment. I really enjoyed that last part that he wrote there. So Verna, Bob, Senator, Katie, anybody?
Yeah, well, that's a given, and providers are working in order to try to streamline and take advantage of, scheduling. A lot of it has to do with re-educating consumers because folks are often under the impression that they can dictate specific times whenever they want. And unfortunately, from a scheduling standpoint, that leads to significant inefficiencies and costs on the part of the providers. So I think everyone is looking at trying to see if they can relax some of those requirements and block schedules, move days. Just by the way, up to, I believe, 2 hours, you got to pay travel time for care workers to travel between assignments. So obviously, if it's taking them an hour to get between assignments, you're paying for an hour's worth of labor with no revenue to show for it. So there are all of those practical considerations, but my understanding is everybody's looking at that. Thank you.
Yeah, from the state's perspective, I agree that we need to change the landscape or the prior mentality that the caregiver, it has the ability to drive, I must have this at this time. There are certain instances where that is the case, but it's not always the case. And we could probably do a better job where they're amenable to changing the hours and having it line up with a fit schedule. And we can definitely do a better job with our providers of working on that with the case managers, with the caregiver, and with the recipient. Definitely something we can work on.
Well, you've got to have scheduling software. A lot of folks are working on putting together the technology that will enable that. It is not that easy to come up with a automated solution, but that's a lot of folks are working on trying to make that happen because of the obvious efficiencies in terms of what it provides schedulers.
Okay. Any other comments?
Brian, it's Colin. And again, I apologize for my voice. So the way this read, and again, this is all incredibly helpful to me, hopefully to everybody as well. Are there mandates that the state has that the way the tone is sort of, we're mandating certain requirements and that's, not helping? Are there scheduled mandates that the state has that we could look at, or is it just the nature of the beast?
So, Senator, the mandate that I'm aware of comes from the provider themselves, and that is with the minimum number of hours that get provided. As Bob had said, if the minimum number of hours is 2, you might have 50% to 100% of that just in travel time alone. So some providers have mandated that they want to do a 4-hour minimum, and that gets that profitability line, where they want it, or that break-even line where they want it. There's not so much wasteful time there. Not everybody has taken that route. Some still have the 2 hours. We don't do less than 2 hours for anybody. We do have a prioritization list because there is a waiting list for personal care, and we do have higher priorities, things that fall by the wayside, like housekeeping, things of that nature, fall to the bottom rung, even though we like them not to, but they do. But as far as what mandates are out there, essentially that's it.
All right, thank you. That's very helpful.
Yes, sir. Second to the last piece is the create proper growth ladders. And I'll just make this kind of off the cuff comment is I keep hearing growth ladders and I'm one of the people that's used it, and I watched a couple different assessments from other states or things from other states, and they stopped calling them growth ladders, and I forget the name that they called them, but when you put in front of somebody that, okay, you want to become a CNA now, and then you want to become an HHA or an LPN and then an RN, and that's it's a linear line, and it's not necessarily what we need. It's not necessarily what people want. You know, we have a lot of people, and I know, I think I may have made this point before, you know, one of our nursing home administrators is a former CNA, and he didn't go through the whole gamut just to build his clinical experience. He went and did an aside and just became an administrator to run a facility. And we need help across the board. We need help in the facilities, but we need administrators too. We need people who do other things in the healthcare field other than just being the boots on the ground. I know it's what's prevalent now, but calling it a ladder, I don't know, that maybe there's a different term that we can use moving forward, just to show the people who are getting into this field that, you know, if you want to go and make a certain amount of money, it doesn't mean that you have to be an RN or, you know, you have to work in acute care. You can do other things as well. Sorry, that was just my little tangent there. So creating proper growth ladders, provide continuing education opportunities and education subsidies based on longevity of service. An example would be direct care workers employed in the field for 1 year and worked a minimum of 1,500 hours and get partial subsidy to take CNA classes. Direct care worker employed for 2 years working minimum of 3,000 hours gets full tuition subsidy for CNA classes. And then CNA works for 2 years with minimum of 3,000 hours and gets partial subsidy for LPN training. Just some examples that he put out there. Those are things that we can work with. Comment, question on that? Again, they're just examples. And
Brian, I have a question.
yes, sir.
You've repeated, or you've made a comment a couple of times. Has there been, or have we ever done a study, or has anyone ever done a study, especially with the state, from the community colleges or even high schools, VOTEC schools, whatever, to find out the areas that the young people really want to go into? I mean, is this, or from what I hear down here in Sussex County, we don't have a great number of students interested in the nursing field. And I just wonder, when you say making something attractive, it's going to take more than just money, I think.
So to answer your question, Wendell, I don't know of any survey that's been done in colleges regarding what students want, or even out of high school, what they want in the clinical field. Katie may know about that. There may be something done in other states. That's a really good point, though, is we're making assumptions. Obviously, people want more money, but what career paths they want to take in the healthcare field, yeah, I don't have that answer for you.
Well, just yesterday, I was speaking to a colleague who was a caregiver for her mother, and she's in a nursing home in Salisbury, and they're having a difficult time. Luckily, this is an older established nursing home. They've got people that's been there for years and years and years, but they're not finding the new people to come in, and it's created quite a nightmare for the employees that are there, because everyone's having to work overtime, but the young people that we're discussing here, and I don't have an answer, but I'm just saying, you know, when the comment was made, and you've heard this many times before, then go to McDonald's and make $18 an hour, or $15 an hour, and rather than coming into a career that does offer great benefits and so forth in the long run, but it's just there's something not attracting them, and I just don't know what that is. But maybe we should think about that, you know.
I'm just speaking for an agency. I've been in the business about 12 years, but if you look back 10 years ago, you had training centers like Dawn, you had schools, you had waiting lists for people to be HHAs and CNAs. Right. So, you know, there's definitely a lot of investigation to go, because that really did a switch. And I don't think, I agree with Linda, I don't think money is everything to them at all. But I do think 10 years ago, a CNA was a desirable job because you made more than McDonald's or Amazon, and you were respected in the field. But somehow in that duration of time, things have changed. And, you know, money, unfortunately, is the root of all evil, and it's the root that inspires people and motivates them. So I think we need to look at that, but we definitely need to look at other aspects of it.
This is Verna. I'll just chime in too. I do know right now the Division of Developmental Disabilities Services is running a survey of the direct support professionals in that field. I don't, and part of the goal is, so Easter Seals is, just fair warning, Easter Seals is closed today. So I have the assistance of my lovely daughter. She's not in her program today. She's here with me. So you will hear her in the background. Anyway,
she is awesome.
Yeah, she's awesome. Col- I know you're DSP. Yeah, she hears us talking about DSPs. Anyway, DDDS is running a survey of the direct support professionals in that division. I don't know what kind of results they've gotten, but one of the goals is to ask what motivates them to continue to be in the field. And maybe that will shift. It absolutely is more than just wages. You find, it is, you know, the folks who are drawn to it because they get with it and they stick with it. And it usually is just because they feel like they have a skill or a particular way of working with whether it's the aging population or whether it's the population with intellectual developmental disabilities. It is more than just wages. But they do still have to be able to earn a living. And I totally agree with Brian. We need all levels. I mean, one of the challenges is as things get tighter, you find that you're losing those supervisors, right? You're crunching more responsibilities into fewer positions, and so you're losing those layers of responsibilities too. So that's also right on target. Thank you.
This is Cheryl Hikes, and we're a healthcare community. We're a small state. It's a healthcare community. People will serve in lots of different roles. The DSPs or CNAs or LPNs or nurses, they go in home environments, they go to hospital environments, long-term care. I mean, group homes, we should not be looking at these necessarily with such strict lines because individuals will work in many settings. And we should try to encourage them to get, to have that flexibility and fluidity, but also to have the ability to move up if that's what they desire and to, follow their heart. There is some studies I've seen. Remember when we did the whole big CMMI push years ago, there was a number of efforts to be able to study on the workforce. There was a workforce development subgroup for healthcare. They did a lot of work with all of our colleges. Now it's going to be dated a few years, but I think that would at least give you some kind of baseline. The folks at the University of Delaware will tell you about the number of I think more than 1,000 people that they had to reject from the nursing program because they didn't have enough space to be able to teach them. I mean, there is an interest in healthcare. It depends on who we're talking about and what kinds of roles, but I do think we need to be understanding of the fact that Brian's right and Verna's right. I'm just dittoing what you're all saying. We need to make sure that we're providing opportunities. And those folks that have worked in these roles for a long time, is there a way to give them credit for their work hours towards education so that they don't have to be looking at, okay, I'm at this level and it's going to take me 2 years of going to school to be able to get to that next level? Can they, find a way to test out of some of this? Is there online training available? Because for many people, they don't have the time to stop working and go to school. So what can we do to be able to kind of put some of them, especially those that have worked in this field for a while, they probably would be able to test out of some of this since they have the work experience. Is there a way to be able to provide that for those individuals? We have a temporary nurses aid online, an 8-hour online class that our national organization put together. We had 750 people take that class to be able to work because it was online, it was free, it was 8 hours. And now they could go to work anywhere. This was, during the early days of the pandemic. So there was an interest out there for something that was easy and free and something that they could go to work immediately. And this was, right when things were really rough in lots of places. So I think there is an interest. It's finding a way to be able to reach those folks and to get them to that next step that we're all talking about. Whatever we call it ladder, you can call it career escalation or career enhancement, but whatever we call it, we just need to be able to find a way to find them and help them move up if that's what they want to do.
Hey guys, it's Colin. And again, I apologize for my voice. Hey, do we have anybody from professional regulations involved in our little group here? And if we don't, Becky, could you remind me, we could reach out and see, because obviously some of the certifications, things like that, perhaps they could be helpful in how to structure some of these solutions.
Well, Senator, the CNAs are not controlled by professional regulations. It would be the nurses, the physician assistants, doctors that are part of ProReg. The certified nursing assistants are certified and maintain that list is done by the Division of Healthcare Quality under DHSS.
Okay, okay,
But you might want to have somebody from both of those.
got it. Okay, thanks so much.
All right, I'll finish this out real quick. And Colin, you don't need to introduce yourself anymore. When you speak, we know who you are.
But
That voice is becoming very
yeah,
familiar.
the guy going through puberty, that's Colin.
All right. So trying to grow the pool of HHA, CNAs, and caregivers. Growth is a factor. Attracting and retaining workers. Attracting it is addressed above. Retaining is a matter of being able to increase compensation based upon competitive market rates for longevity. Again, ability to accomplish this would be based upon employer income to support this. We all are very aware of this, and it's probably the predominant thing that we need to look at. One option would be to offer some form of longevity bonuses on a periodic basis, and to have some portion of those bonuses funded through a supplement to the unit service provided, paid by the state. This could allow employers to increase compensation for longer term employees and at the same time minimize the overhead cost impact of these bonuses, allowing more of the benefit to flow to the service worker. Let me just hit this last part here. I asked for any other areas of need, and he said the availability of childcare is a significant barrier for many to enter or working in the service care industry. A significant portion of this current and potential workforce are single mothers who do not have access to affordable childcare that would allow them to enter or remain in the workforce. Daycare subsidies or vouchers for service care workers would reduce barriers to entry and help to reduce absenteeism and other employment conflicts.
I would just chime in, Verna, again, that we have absolutely seen this be an issue, especially during COVID. We've had so many care workers have to just drop out because of the challenge of childcare.
Thank you so much, Brian, for sharing all of those comments. It's really helpful. Other service providers, I know we have a few here on the meeting. Other comments that you'd like to provide from your perspectives? Because you certainly all have invaluable perspectives and input to share into all of this.
I would just say that I think Ken did an excellent job actually in summarizing a lot of those issues. Just a great job that you would see the provider industry in general just chiming in and saying, yeah, he did our work for us, I think.
Thanks, Verna. Yeah, certainly a lot to digest, and perhaps there's a way that we could sort of bundle some of those areas of concern / recommendations together, again, because we want to really boil it down to 2 to 3 truly actionable recommendations that we can present to the full working group, and then hopefully to the General Assembly that we can take action on here in our state. So, but maybe there's a way we can bundle some of those areas together into those 2 to 3 recommendations. So again, I know we have a really robust agenda today. So if there aren't any other comments related to the service provider feedback, I guess we'll move on then to Easter Seals, Verna, for your presentation on respite.
Verna, I will bring up the PowerPoint for you. Just give me 1 minute.
Let me unmute myself. That'd be great. Yeah, so we've gotten the second bench because I had actually asked Nancy Rinaldi, who's the director of our community outreach program. She actually put together this presentation and she had an emergency, family emergency come up. Her husband had COVID. Okay, we don't need to share that, okay? And so anyway, she wasn't able to be here. So I'll try to go through this quickly though. And Katie, please feel free to chime in. Nancy is our director of community outreach program at Easter Seals. She's been with Easter Seals for over 25 years, and she really has focused. She's a PT actually by training, but she's focused a lot of her career on, especially in recent years, on just caregiver services. And ironically, she and others pulled together a coalition to created a respite coalition that just had their initial meeting back in November, and really tried to gather a lot of different organizations to talk about the challenges of respite in Delaware. So they met in November. The types of agencies that were represented in that conversation, Katie, of course, was part of that conversation. We had the Brain Injury Association, ALS support group, Parkinson's, cancer support, community support, Champions for Children's Choice. And then also there, I believe there was someone from DSAPID, some other community agencies. And then I think Nancy indicated, she gave me notes to cheat sheets to go with this. Since that meeting, they've added La Esperanza, the Latin American Community Center, and also a church that has agreed to join the Respite Coalition. So this is sort of a more recently formed group that is taking a look at the challenges of respite, providing respite in the state. Katie, you can go ahead to the next slide. And this is reminiscent of what we in a larger group, work group, when we had the caregivers come, but it really is sort of a clue to kind of some of the things we have to take into consideration if we're trying to pull together options for us to recommend. With caring for aging parents, my social life has decreased significantly. I truly treasure any time I can get away to be with other family and friends. The break allowed my wife to spend more time together with my daughter and without me. Again, it's that, you know, the impact that has on the family dynamics, the need for respite, and how that really feeds and that need. After having respite, I realized I don't have to do everything myself every day, every hour. Caregivers get overwhelmed, and they get, it's like it draws you in, and you don't realize, wait a minute, you know, I need to do something about this. Again, it's taking care of the caregiver. And again, this program gave me the freedom to do errands, get away from the stress of constant caregiving for a couple of hours. It was a lifesaver. And one of my favorite feedback that I remember is just a caregiver who, she literally wanted to have respite so she could get some uninterrupted sleep, you know, like a night of uninterrupted sleep. So next slide, Caitlin. So the defined purpose of this Respite Coalition is to determine what other types of respite options families need and want here in Delaware, and then to come up with some recommendations on how to meet those needs. Next slide. So Nancy went through and pulled together some examples of where we see some resources, current resources for respite funding. And I'll just run through these fairly quickly. They were examined at the coalition meeting, I believe. And I'll say too, that it seems like a lot of times the respite funding that is available, it's funded through the particular, obviously the revenue stream, but it's the service agencies. Like in the Division of Developmental Disability Services, they have respite funding available to families, provided the person is receiving or eligible for services under DDDS. This is the intellectual and developmental disabilities population, right? It requires sort of planning in advance to get approval in advance to access the funds to pay a caregiver. And then there's an annual cap of about $2,700 that the families can utilize. So you can hire a caregiver using those dollars. I think they are actually considering and are going to raise that. But you could hire a caregiver to come in to up to that amount annually. There are requirements, however, in terms of, as we referred to earlier, the training that caregiver must have, the background check. There's a first aid training required, fingerprinting, all of that. So families do have to comply with a certain level of regulation before being able to utilize those dollars. Next slide, Caitlin, is Hospice also, there's funding available through hospice, a Medicare benefit with a hospice can fund through any hospice agency. It must be used out of the home, however, i.e. in a hospice facility, which of course would require some planning again in advance. And there's a 5-day respite limit at a time, which you can do more than once, but there are still some overall limitations to that. Next slide, Caitlin. This is a self-directed attendant program it's a Medicaid managed care organization benefit, allows up to 336 hours of respite per year. Again, the caregiver provider needs to go through the same training, this training process. Next slide is through.
I apologize. What does self-directed care?
So self-directed is where the person with the disability or the need is making the choice of the caregiver that they are hiring. That it's basically they're directing their own care, self-directed care.
Got it. Thank you.
This other source, Brian, feel free to chime in. The DSAPA, Division of Services for Aging and Adults with Physical Disabilities, has respite funding available. That's available for caregivers 60 plus. This is primarily for personal care assistance. It's not what you would consider a traditional respite. But it's essentially you have access to have a caregiver come in to take care of those personal care needs, getting up in the morning, meals, and that has a current list. Currently has a waiting list. And Brian, this is what you were referring to earlier, correct?
I'm not sure if I referred to it earlier or not, but there are 2 other small respite programs that we do run that aren't listed here. I don't know if it's because they're not through Easter Seals.
No, these are not all through Easter Seals. I should have qualified that at the beginning. These are the things that were that came together. But yeah, and I think one of our goals should be to add to this list.
Yeah, so there's one called I don't want to mess this up, the Grandparents Relative Caregiver, that takes care of, I don't want to mess this up too much, but essentially grandparents and other relatives that are taking care of not children, not their children. There's a program for that. And there's one other one. Let's see if I can.
Yeah, actually, Brian, that is done by Easter Seals, and I'm getting to that in just a second.
Oh, okay, great. Okay. And then that other one, the lifespan respite as well.
Excellent. So go ahead to the next slide, Caitlin. So this slide does actually just goes through the references, one of the items that Brian was just talking about. So Easter Seals has access to some funding through DSAPID, and we run a respite voucher program. And basically there are 3 programs under those respite vouchers that people can qualify for: the lifespan respite, the child and adolescent caregiver respite, which I think is the grandparents. We kind of call it the grandparents respite, and the relative respite. So these sources of respite funding are managed through Easter Seals and our community outreach program, and families can apply for up to $500 a year. And they often are, you'll find that it's families who don't qualify for other sources of respite funding that we process through this program. For example, families with family members with intellectual disabilities would not qualify for these types of respite because they have access to funding under their own division, under the DDDS. So we really try to hit the families that are not qualifying for other types of funding. Yes, the Easter Seals very much appreciates our partnership with DSAPID on that, Brian, and so many other things. I think, is there more? Let's see, another slide. Oh, some of the things, again, to take into consideration, we get feedback on why caregivers don't necessarily always look, they don't ask for respite, or sometimes they don't even utilize all the funds that they've applied for. Planning is a big deal. They're, overwhelmed. They don't necessarily have time to plan too far in advance. Sometimes it's a matter of difficulty finding the appropriate care for the child with significant behavior issues. That's a major need out there. And this applies to a lot of them, the older population. They don't want strangers coming into their home. And then there's also folks we hear, they don't necessarily, they don't necessarily need funding, but they need somewhere to take their loved one. So somewhere like a drop off that they know that the loved one can receive excellent care for the respite, and they can even pay out of pocket, but there aren't those places that are easily identified. So this has come out of our considerations, but again, also as part of the Respite Coalition group, there has to be a menu of options for families to access respite. Sometimes it's vouchers that will work. Sometimes that they can utilize a database of volunteers. If we could get that going, and sometimes instead of having someone come into their house to do, they want to have their loved one go into more congregate setting for respite, again, outside the home. There should be additional funding for respite for families that don't qualify for specific programs. And also we could use funding to manage a database of providers. Again, if we're building the overall caregiver workforce, and then we're able to manage a database, someone who's working in the system during the day then could be very much interested in, providing additional hours if we knew how to connect them with the families. And this was based on just some other, this was actually a Wisconsin respite group, I believe, that Nancy was following, some other ideas for what respite programs can look like. Faith-based site providers providing respite care for individuals, basically developing a respite day program, a safe place for adults with disabilities and memory impairments to go, a childcare business. You can add a respite program within a childcare business to give parents with children with special needs a short break. During the summer, offering, shelter at some sort of a respite at a park shelter. Again, a drop off, something which is more organized, but out in the community. You spend quality time with an older adult while their loved one goes shopping or has doctor's appointments or does something for themselves. Another way that it's identified. If I only had someone, that I could, go to the store by myself, run out and do some errands. And then the last one on there is you want to provide employment for in-home respite providers while taking care of the business side of your program. Again, identifying another opportunity there. I think that was it. Please chime in.
Thank you so much, Verna. Go ahead.
Oh, the only thing I will say, Nancy did say, I guess the Respite Coalition next meeting is January 25th, apparently. And they haven't, because I was asking her, I'm like, well, do you have, has the coalition defined a timeline? Because obviously if they're coming up with thoughts and recommendations, that could be helpful to this group. And they really haven't gotten that far yet. That's the idea. But they don't have a specific timeline identified as of yet.
Well, and I serve on that, as you mentioned, Verna, I serve on that coalition along with Nancy. So certainly I can bring back to this group what's discussed, any sort of recommendations that might be coming out depending on timeline. But, also bring our discussions here as part of the subgroup to that coalition as well,
Exactly,
to sort of bridge the gap between the two.
exactly.
We have to share you? Who says? That's we don't want to share. Come on, we don't keep you.
So are there any questions for Verna or comments? I mean, certainly I can start and just say, on behalf of Delaware's Alzheimer's and dementia community, respite certainly is a much needed service for Delawareans who are living with Alzheimer's and dementia and their families, and really does benefit those living with the disease as well as the family caregiver. Some of the areas, I think, barriers that we've heard about are things like cost. A lot of families having to shoulder, especially if there's like a financial qualification towards accessing the respite funds. If they don't qualify, having to shoulder the cost of respite themselves can be a barrier. Transportation is another barrier that we've heard about. Cultural barriers, certainly families who don't feel comfortable having someone come into their home or having their loved one cared for outside of the home. And then another really big one is just, I guess it's kind of twofold, is awareness of the resources that are out there and awareness about respite itself. But then also just even identifying as a caregiver, and certainly, speaking for the Alzheimer's and dementia community, a big issue that we run into is just a lack of detection and diagnosis of dementia. And that's something that we're working towards, is raising public awareness about the importance of early detection and diagnosis. But without that diagnosis or detection, and without identifying as a caregiver, that's another barrier that we found in terms of people accessing respite care themselves and for the loved one.
Definitely.
Other questions or comments for Verna?
Just say thank you very much. Very helpful.
That was great. I think as we think about the workforce and supporting family caregivers and aging in place, respite really plays an integral part in all of that.
Well, I think, again, if we keep in mind the goal needs to be keeping people living at home, independently for as long as they possibly can be. It's not going to look the same. Certainly for everybody, there's going to be a lot of different steps along the way. But again, that goal is, coming together to make sure that there is an awareness of the resources. I know that's one of our biggest challenges, is just, getting the message out to folks that we're available, we want to help. Even within our community outreach program, we have case managers on staff that the goal is to be able to answer questions and help get people headed in the right direction if they are caregivers looking for services, looking for resources. But again, if you can't get the word out to the population that the help is there, and we're just one agency that's doing this, that every agent, other agencies are doing similar things, you're often not reaching the people who really need the help.
And I just want to, I think this goes without saying, I actually worked with all of them doing the grandparent and the different grants that you have. And the one like that you had, I think was a span or whatever, was, we help with someone getting chemo. They're there, and they needed help. But I think the one thing that we all know that we still have to think about, ever since I've been doing this, I don't think the $500 ever been revisited. Has it, Verna?
It hasn't. It has not.
And
the $500 limit has
the
been.
cost of living has went up. Private caregivers, family caregivers, agent around the board. That does not get you much respite help. And I think, that's something that we have to kind of consider.
And it's sort of an indication overall of what we've seen, right? In the professional workforce, the wages, they've been allowed to kind of be stagnant, right? And across the board, whether it's for workers in the intellectual disabilities population, in the long-term care population, they've been allowed to just stay stagnant for so long. That's why they're so far behind. And it's the same with these types of things too. It's that the adjustments haven't occurred on a regular basis. And so again, like you say, Jackie, you're absolutely right. The $500, that doesn't go very far.
Thank you. All right. Well, thanks so much, Brenna, for providing that presentation and all that really important information. So moving along on the agenda, the next agenda item that we have is the family caregiver perspective and scope. Certainly as we work to strengthen the professional workforce, and we absolutely cannot ignore the vital role that family caregivers play in all of this and the need to support the family caregivers. So for that and provide that integral, perspective to all of this, an important input, I'm going to turn it over to Wendell to provide that caregiver perspective.
Thank you very much. Happy New Year, everyone. When we concluded our last meeting, Senator Bennie asked if I could do some research on, back a few years ago, there was something to do with the care and scope of practice between family and caregivers and professional caregivers. And basically, what I found out was more specifically, family volunteer caregivers can be trained to do at home as opposed to what's required by a professional. So, Senator, does that sound like what you remember?
Yeah, that's exactly what I remember.
Okay.
Thank you.
Yeah, we did. Thanks to Sheila Grant at AARP's headquarters here in Delaware, she knew exactly what it was about. She had to do a little archiving, but it's kind of what I've been talking about. At least I shouldn't say just but what my passion is for the caregivers in the home. And if you will permit me for just a minute, before I would like to put up Caitlin, I would like to put up the information I sent to you in just a minute. Sure. But just a couple things that AARP has been involved in the Caregivers Task Force, and the blueprint, we call it, was back in 2016. And most of you know this, so I'm sorry, I don't mean to bore you, but just as a reminder, maybe a refresher. But passing the CARE Act was in 2016. The second thing was prohibiting workplace discrimination against caregivers, also was enacted in 2016. And tax credits for caregivers, Senate Bill 143, currently under position. This was back in 2016. By AARP was supporting this effort by providing information on the fiscal note. Expansion of the federal FEMA FMLA to provide paid leave for an employee's own illness or a family member's illness. And I believe AARP is still supporting, and Senator, you probably know this, and everyone else, Senate Bill number 1 is currently under consideration in the Delaware General Assembly. And then to amend the Delaware Nurse Practice Act to allow nurses to delegate additional home health tasks to direct care workers. And Sheila said there'd been a lot of opposition to this, but our compromise was passed to share the CARE Act in 2019. So these were just some recommendations that came up in the past that I wanted to share with you. And then in doing some research about the caregiving support, I think you'll find a brochure. This is back in 2015, but when I reviewed this and discussed it with our AARP staff, it's so fresh, it's still current. And I don't want to take time, each of you have this, but I would like to just, if you could go down to page 7, I believe, or 6, I'm sorry, page 6. And it's what are the community doing in preparation for the increase in caregiver needs? And when I read this, it's got a lot of the information that our whole team here has put together from different states and so forth. And I think everyone, this must be countrywide. Mr. Byrd was part of this back in 2016 or 2015. And I think we're all still working 5 years, 6 years later, coming on 7 years now. And I'm not sure we've crossed that pinnacle to where we solve or maybe we've added meat to our caregiving at home, but I don't think we've gotten there yet. And I think it's nationwide from California to Florida, where we're all working toward the same goal. And I know Mr. Byrd made a comment at the last meeting that stuck with me was, he's been working on these presentations and these task force for several years. And we sometimes are reinventing the wheel. We don't want to, but we don't realize maybe the material and the work has been done before. So, and that's not an insult to anyone. That's just the way society is. And but it's interesting that we still have these. But this information still, we're digging for this. And on page 8, the recommendations for improving family caregiving support in Delaware. And you'll see that it's based into 3, it's the legislative recommendations. And I'm not going to read this verbatim, but similar to the CARE Act in other states, to involve caregivers in the discharge of their loved ones from the hospital to the home. And one of the things that Sheila and I had a discussion about is by the policies that are made or was made already and passed by the Caregivers Act in hospitals when they discharge someone. And I know it's happened to me because I've been a patient in my own hospital, and no one really came to me and asked me, do you have this at home, or are you able to take care of yourself at home? Fortunately, it wasn't anything serious, but I wasn't asked those questions by the hospital. And I think they're just so overwhelmed with the number of patients. Just as a side note, BB had 104 people on Thursday, last Thursday, in the ED waiting to be attended to. They hadn't even been triaged. They were there, and most was of COVID. But we had number 2 on that was to enact the legislation that prohibits discrimination against caregivers in the workplace, meaning that fortunately for me, I was retired at the time when my partner was struck with cancer. But still, had I been working, it would have been a difficult task. I don't think my employer would have at all had any problems with me taking time off, but there are employers that might not allow the time that a caregiver at home may need. Move beyond the minimum requirements of the Family and Medical Leave Act, such as covering workers in business with fewer than 50 employees, expanding the definition of family member to include in-laws and others, expanding and allowing the use of FMLA to include employers taking family members to medical appointments, decreasing the time the employee must work, and so on and so forth. Amend the Nurse Practice Act to allow nurses to delegate additional home tasks such as wound care and so forth. And you'll see in just a few minutes when we scroll down to the bottom here, we actually have some videos. And I have to say that this was new information to me because you might remember in some of the previous meetings, I felt like it could be like the driver training program that we could put together an hour or 2-hour seminar or 4-hour seminar on family caregiving. Because, in speaking to a colleague just this week, she said one of the things in caring with her mother was, and she said, I had no idea, and someone just happened to whisper to me at the doctor's office, or she overheard him talking, and that was, mom receives thousands of calls or hundreds of calls a day, and she has no idea who they are, and she'll tell them anything. And because mom was 90 and elderly, but she said, I found out by someone else that I could forward her phone. And this is an educated lady, but she never gave it the thought that she could forward her mom's phone to her phone so she could intercept these calls. It may sound elementary, but it's very important. And when it comes to family caregiving, as I did when I went through my situation, I had everyone call me on my cell phone, not to use my house phone at all, just because I didn't want a disturbance in the house by the phone ringing. Then we talked about, we moved to budgetary recommendations, providing funding for the development and implementation of a marketing and communication strategy. And this is what I think, this one hit me because I think we've all sat here today and we've all heard this, the message that sounds like communication and people not knowing where to get these resources and not how to go and don't understand that they're even available. And we talked about this in our last meeting. So I think this is something, when you talk about a bullet point of consideration, I would think that all of us, have to do maybe a better job in communicating all of these wonderful services that the state has and all of the things that we can teach our personal caregivers that they cannot afford the professional caregivers, that we can teach them in-house. So I think it's right on as far as I'm concerned. Expanding funding to ensure that direct care workers such as home health aides are paid competitive wages. So the money thing is always still there, and to try to increase the wages, make sure it is competitive. And then the policy recommendations, collaborate with business leaders, service providers, and consumers to explore new policies which support employed caregivers, such as providing paid and unpaid leave and providing workplace assistance programs for caregivers. Support the implementation of the Delaware Telehealth Roundtable Strategic Action Plan. Extend and expand the authority of the Family Caregiving Task Force to monitor implementation of the adopted recommendations, and then to review and design the delivery of caregiver services. So these are just a few of the things, and then create the comprehensive guide. And we do have I think the guide here, and keep our delegation informed, our congressional delegation, as to where there might be issues or problems. And if you can scroll on just a little further for me, here we go. You'll see here on this slide that the resources that are made available that probably most of you know about, but I just wanted to bring them to your attention. And then if there's one, I don't see it there, if you'll, it talks about the videos that are available. And can you scroll a little more? Caregiver, I don't see it, but I think it might. Well, anyhow, I'll make sure I get the information to Caitlin to get out to you again. I may have omitted that page. I hope not. But anyhow, there's some short 2-3 minute videos that one example was a wound care, and the nurse was teaching the young man to care for his dad's arm that had a big sore on it in a wound care situation. So that's pretty much, I think I could go on for hours, and I don't want to do that. I'm guilty of making a long story short because they get longer. So, but any questions that I might answer? AARP has done a tremendous amount of work, as most of you know. And Verna, I see you're shaking your head because I know your name has come up in our discussions, and Easter Seals has done a wonderful job. I think all of the professional services we have in the state, it's just tremendous, but I do think we need to better educate everyone. And Verna, if I speak to you just a second, a lady came, I was volunteering at the thrift shop recently, and she found out that I was on this committee through my friend. And well, she said the only place she found help was through Easter Seals. She called your office because she was looking for a friend whose partner had passed away, and she was looking for a respite area where she could take her, the care that she's caring for, and take the lady to just an outlet where she could be away from her home. She went into terrible depression, as we can understand, but they were trying to help her get out. But Verna, just hats off to you and your organization, because whoever she spoke to said y'all were wonderful.
Well, I appreciate that. I really do. And we have some amazing people who work at Easter Seals and have really dedicated their life to exactly what you're talking about. So we always appreciate hearing that. But there is, as we know, there's always a need. And it just seems like, again, it is creating awareness. One thing that I want to quickly mention that you was in that report, which was that was a tremendous effort by AARP. We're always happy to partner with AARP on these, but it's that use of technology. Also, there's several references to being able to utilize technology to help in terms of meeting the needs of the caregiver. And I think that's a good footnote. I don't know if it boils down to our 2 or 3 that we have to hone in on, but oh my gosh, the availability of different types of technology now is just tremendous. And again, Nancy Rinaldi is the expert on that. She handles our assistive technology department. You've got DATI is another resource, but there is so much new and innovative technology that can step in and provide support for a caregiver. But folks don't always have access to the funding to get it right. But that's another area that we could really use some attention to, I think.
And it could be something that's a good point, but it could be something that, like we do with schools, there's so many, every kid has a laptop. Well, an agency or someone could monitor, in fact, provide when the need arises and someone can't afford it, that they provide, a laptop to somebody or something where they can get that technology, or a resource center through the senior centers, the cheer centers, where they can go and be able to access the material that you're talking about. Because I honestly believe that is a deficiency that we have. And it's not just, I think it's nationwide, because I think seniors just don't realize, unless they're confronted with it, they just don't realize our resources are tremendous. And they don't, and the other thing is limiting and I know you hear this every day, but I just had someone tell me, my gosh, do you realize I spent hours and hours and hours trying to get through something about Medicaid or something. but she said that the forms are just endless and endless and endless. And I know that they're necessary, but you know, we always said years ago we were going to become a paperless society. Well, it's far from that. So
I wanted to bring up one thing. Yesterday would have been the 2-year anniversary of my mom's passing, for whom I was a caregiver for at least the last 4 or maybe 5 years of her life. And she received home care with us and at her home, and we had services. But when she had a various incidents, she spent time in post-acute facilities and then went back home, either to our place or her house. So I've experienced this personally there. But during the pandemic, I can tell you that a lot of the folks I know that were doing family caregiving, and we were fortunate enough to be affluent enough to be able to afford that, there was not the access to testing, vaccines,
Sure.
training, education about COVID that there probably should have been.
mhm.
And to know who is getting care or who is caring for a vulnerable individual in their own setting, not in a group home, not in a facility, those we can sort of have an idea of where all those individuals are, but everybody else who's taking this on, and not
Mhm.
everybody is fortunate enough to be able to afford extra care
Right.
and all that. Some settings for which people are, caring for their loved ones probably need some help, need some inspection, need some services, need somebody to come out and say, hey, this is not a safe place for somebody to be with a wheelchair or a walker. We
Right.
need to make this kind of accommodation for you. So, some of that is to be able to assist people that are trying to take care of individuals at home, because I think it's a luxury for many people, that have the money and have additional family or other support to be able to do that. But for those individuals that are at the lower level of our economic
Right.
situation, don't always have that same, either they don't know where to find the resources or they don't have the financial resources to be able to handle it. So I think we also need to be kind of look down at that level and see what we can do to bring that group up, because I think that's where a lot of people are sort of missing the level. And I think one of the reasons why we're having such a big surge now is a lot of those people in that setting didn't have access to some of the information they needed for prevention around COVID and caregiving. They just didn't have it or didn't hear it or couldn't get to some place to get the various information. And that's where we may be missing the boat. If we're preaching to the choir, like we're preaching to this choir of people who are involved, there's a whole nother subset of our citizenry that's not represented on this group. And I'm not sure how to get them engaged, but we need to be thinking about how we can do that, because it was obviously a very missing block of people. And a pandemic had to kind of point it out to us, I think.
Right.
But thank you, Wendell. That's very good information to have.
Thank you.
Wendell, thanks so much. And I, for one, I love your accent. So just keep talking. I could just say talk too much. Is it Texas, Wendell? Is it?
As I tell everyone, Senator, I'm from the Bronx. Can't you hear?
I just love it. First of all, thank you.
Native Virginia accent.
I love it. I love it.
Thank you.
First of all, honestly, and tremendously important. And I know it's going to be a fight, but I actually think maybe at some point we need to revisit sort of the scope of practice and allowing people to do things at home. But for the folks either in the state or providing the services, is there a central clearinghouse phone number? And we have the Division of Aging, of course, and they do a great job. But if I'm out in the community, which someday I hope to be out in the community, do I say dial 211? Do I say, what is the quick and dirty to say, hey, there's services available. This is the best way to access them. And if that's an unfair question, please tell me.
Well, Senator, if I may, couldn't it be something that if there's a central clearinghouse number, such as an 888 number or something that was just listed as adult services, maybe, or come up with another name, and then it would be through that bank that you could be directed then to maybe the agencies that, you'd have to explain your gosh, this almost sounds like telemarketing, but you could take the information, then you could like send it to Brian's department, or it could go to
So
Verna, or it could go to wherever.
Yeah.
it's out there already.
Is
It
it?
is. Okay, thanks,
the
Brian.
ADRC, the Aging and Disability Resource Center, and the numbers 800-223-9074. Got it memorized now. They should be able to direct you. It's supposed to be a one-stop shop,
Great.
no wrong door, and they support you and send you down the avenue that you need to go.
Oh, good.
And that website, which is the same thing, I think it's like DelawareADRC.com. So you can get onto it obviously virtually, or you can, make the phone call. But they should be able to handle all of those needs and get you. If we're talking about respite care, they know all about it. They can point you to Easter Seals if need be. If they weren't able to get to them directly, you can get them there indirectly, and so forth. And the idea is that it's a no wrong door, and they can help you with any need that you have.
Oh, that's great. That's exactly right. So I have sort of an odd suggestion. I have a business life and the political life. If you want to get word out, like that phone number and webpage, get legislators. This is a unique political environment, and trust me, all of us are very plugged in with what's going on, and especially seniors. If you one way to get the word out is just constantly barrage the legislators to please pass it on, and you'd be really surprised how quickly we can disseminate information, because we're asked to do things all the time. So I don't know if that's helpful or not, but
I think that is helpful, Colin. And I know one of the things I've done is try to see, what legislators are holding coffees, constituent meetings. And I've actually reached out to try to have Nancy Rinaldi from our staff, scheduled to come and do a presentation at a constituent coffee that the legislators might be having. But that's just one small thing. But I think it has to be consistent, though. It has to be ongoing, and it's almost in the news, the newsletters you're doing back to constituents. It can't just be kind of a one and done. I think that tends to be the challenge, is how do you keep it going? And you may not know today, you may not need to be in a position to be a caregiver, but you might be tomorrow. So you're going along. So again, it's like you have to be there to meet the need when the need arises, which again means, in my mind, it has to be ongoing and consistent. And we certainly do a lot with through social media as much as we can. But again, not everybody's on social media either, especially well, it's not a good generalization to say, especially the older generation, but you have some that are not online at all. So how do you meet the need? How do you get the messaging out to those folks?
good point. Good point.
Well, thank you so much, Wendell. That was really great information. And I have to tell you, I recently read that you received an award through AARP for your community service. So just hearing how passionate you are about serving your community and positively impacting social change, I can tell why you received that award. So congratulations on that too.
Thank you.
So I know we're just about time. Caitlin, do we have any members of the public? Because I think we're at that time on our agenda here for public comment.
We do not at this time.
Okay, great. All right. Well, it's just about 11:30. So thank you so much, everyone, for such a great conversation and discussion today. Verna, Wendell, thank you so much for presenting and sharing your input and perspectives into today's meeting, and Brian as well, and Jackie, and for everyone on the call, just thank you so much. As I mentioned, the next full Aging in Place working group meeting is January 21st. So Senator Bennie and I will be sure to share with that group the work that we've done as a subgroup and the progress we've made. And we look forward to coming together again very soon.
Okay.
So
Thank you,
all.
thank you,
all.
everyone, for all the work put in for this one. Thank you so much.
You're welcome.
Thank you.
All right, thank you. Bye.
Bye-bye.
Mhm.